Short axis of the right ventricle and great vessels view. Short axis of the right ventricle and great vessels view is the fifth of the 9 diagnostic views and one of the 2 oblique views. It is the long axis of the right ventricle and pulmonary trunk as it emerges from the right ventricle and points to the left. Checklist. First, the presence of vessel that connects with the morphologic right ventricle positioned on the right and that can be defined as the pulmonary artery. Second, the pulmonary artery is characteristically branching at an acute angle bifurcation after a short distance from the pulmonary valve. The branches are the right and left pulmonary arteries and continues posteriorly towards and to the left of the spine as the ductus arteriosus. Third, the presence of a pulmonary valve with normal systolic-diastolic excursion. The valve leaflets disappear completely during systole, being flattened on the walls of pulmonary artery. Fourth, the presence of crossover.